All right, welcome, Dr. Lloyd-Hazlett. Thank you so much for being here with me today.
Thank you. Thank you for the invitation, and I'm glad to have some time to share some dialogue with you, Dr. Schuermann, about ethics.
Yes, yes, that is the topic of the day, ethics and how we navigate our own values in talking about ethics. So, if you would introduce yourself to the students and talk a little bit about what brought you to studying ethics and counseling.
Yeah, well, thanks to everyone tuning in. And I am Dr. Lloyd-Hazlett. I am a counselor, educator, and supervisor, and have been for about 10 years. And some of my backgrounds are in couples and family counseling and integrated healthcare. And I mention that in cases of interest, and also as we are talking about ethics, context can make a big difference, in that as well. So I think that's important to know. And how I came to study ethics, I'd say maybe a seed was planted when I was in my first, ethics class or taking ethics in my master's program. I remember being intrigued by the class, knowing that it was important, and also wanting for it to be like more black and white. I didn't like all of the depends or like what ifs or, unknowns that felt like they could be there when we are doing really important work. So I think that is where some of my seeds were planted. Also, as a counselor and as I've been developing my counselor identity, something that's remained important is a lot of respect and appreciation for the complex and kind of sacred work that we are able to do as counselors. We work very intimately with others and often in vulnerable times in their lives. So knowing that this was important as a profession. And then, from there, I'd say my first kind of formal study or where I'll start, at least on the timeline, is when I was working on my doctorate. My dissertation related to ethical decision making. And particularly, I was interested in, at that time, it's been little years ago, but there had been some lawsuits in the counselor education field related to um, student counselors not feeling comfortable working with clients due to value conflicts and referring them, and kind of the ethics around that. Which later led to a revision in our code of ethics and kind of the current form of that, where we looked more closely at values-based referrals, competence-based referrals, et cetera. But I was really interested, in that, both for the client welfare and also, as students, as counselors, we all enter the field and our programs with different experiences, different, worldviews. So how we can try to uphold and honor all of that while maintaining our responsibilities and the welfare of our clients. So that is kind of where it started. A couple other research projects or things that I wanted to just mention for this group is I had done some research looking at how student counselors understand when it is appropriate to make a referral, kind of what is our line of thinking. And talked to students at different stages of development, both development in their program and also in something like called cognitive development, which relates to our ability to kind of tolerate the gray, to know that there can be like multiple possibilities and perspectives. And so how that might impact our ethical decision making and our understanding of referrals, and found some interesting things there. Have also looked at related to working with couples and families, decision making related to breaking confidentiality when it relates to working with minors. And so that's some of the research that I've done and some of my start, and still very much an area of interest and practice. Yeah. I'm curious, what about for you?
Thank you. Sure. So I have not done any research based in ethics, but I do think that it is one of the most important areas that we study in counselor education, and things that really, I think, stand out to the necessities of being a counselor long term. Understanding the importance of ethical decision making and how you don't just learn a model when you're in school, but you carry it forward with you as a tool to help you as you progress. And if you keep that practice, you help ensure that you are making your client the main focus, making ethical decision makings around your client kind of remains your goal throughout your whole career. So I think
Absolutely.
it is an important topic, and I'm so glad that we're here to talk more about it.
Me too.
All right. So the first question, and these are questions that students submitted for you. What are the most common values or ethical dilemmas that you see students and new counselors face?
Okay. Well, this is a great question. These are just some thoughts that I had. I think that it's important to know, what those particular dilemmas or where our values come into play are going to differ, for each of us. So this is not exhaustive, but one of the things that I've both encountered and have seen in new counselors, existing counselors, but particularly some new counselors is this idea of, oh, I can't work with them. And that can mean, different things. Sometimes, that is related to someone that maybe has a criminal history, or there's a history of abuse, maybe a context or worldview that we don't have a lot of, familiarity with, but kind of like a fear, a hesitancy, or uncertainty about can I work with this person, or not. And so that is something that I've seen, and I'm always grateful when it comes up in our conversation, be that discussion boards or in classroom conversations, because you're probably not the only one thinking that, or wondering that. And I think a really important practice in ethics and ethical decision making is dialogue and consultation. And with that particular challenge of, can I work with this person or not, I like to encourage us to, to push ourselves to think a little bit more, deeply about that. What is coming up for us? Also, the thing that maybe feels like we can't work with it, might only be like one facet or part of our client. And so I'm trying to keep the full person, the full picture, in mind. And something that came up in the research that I'd mentioned regarding referrals was this idea of, our scope of practice, our competence. As new counselors, we may not feel competent in much, or, and so a finding that came out of that research that I thought was really inspiring was this idea that, our competence can grow. We do want to practice, within areas that we have training, but also that that is a dynamic process that we can learn alongside our clients. We can learn, with our clients. Um, Another thing that I have seen new students and counselors face, and more veteran, I don't think it gets easier, but are ethical dilemmas related to risk. So, be that suicide risk assessment, be that assessing for potential abuse or neglect of a child, of an elder, also, abuse that is maybe happening to a client that isn't reportable. And so that is something that is a reality, of the field. I've found again that consultation and being willing to speak the concerns out loud to your peers, to your supervisor, to be, so important. And to try to be transparent, with our clients as far as what our responsibilities are and why. But that, I think is a challenge. And I think the last that I wanted to mention for now is related to self-care and our own, wellness as counselors. And that definitely intersects with our ethics. Our self-care, our wellness is in the code of ethics. And it also, I think, intersects with our ability to make ethical decision making, to be present, for our clients. If I'm in a space of, less wellness, then it makes it harder for me to do, other parts of my job. And so I think with new counselors, um, you know, seeing their self-care and wellness also as an ongoing part of our identity, an ongoing part of the job of being a counselor. Also being aware of our limitations, our own parameters. Many of us enter the field because we want to help. Hopefully, most of us, that's at least part of our motivation. And I think maintaining our self-care in some of the limitations of the work that we can do, or some of the work that we do is challenging and can sit with us. And so just, I think, a challenge of what that really means and what it means for you to maintain or be working on your own self-care.
Mhm. Yeah.
Yeah. How does that align with some things that you've seen?
I think that is almost an exact match to the kind of top three concerns that I see. Um, I think that the conflict or potential conflict or, kind of not real but perceived conflict of values versus scope of practice is a really important one because it does feel so unclear and not black and white to new counselors. So this idea that, a part of someone's identity you may not be familiar with, right? As a straight white woman, I might not understand the experience of an African American woman who is a lesbian, but that's part of their identity. If they're coming in to see me for, let's say, anxiety, well, that's in my scope of practice, right? And so the idea that, well, I don't know their worldview personally is then not a rationale to refer. It's my job to learn about their identity and be able to serve them in the most ethical way because their presenting concern is in my scope of practice. And
Yes,
that's just one example that I think, students will throw out. Well, I don't know anything about, being transgender, or I don't know anything about being Mormon, or whatever the difference is in identity. And so, okay, time to learn. So
absolutely.
Yes, really differentiating between values-based referrals, which are unethical, to a scope of practice, really looking at what the presenting concerns are. And, going through a master's program gives you a pretty broad scope of practice. And so you may still need to learn more about whatever their presenting concern is, but you should have a good foundation for it.
Absolutely. And I really appreciate, that you talked about, the onus for that learning, being on us as counselors, to recognize where would benefit to further our knowledge or to even engage in, reflection. And that, that a lot of that onus and that responsibility that we agree to in entering, the profession. And when you were talking, it also, reminded me of the importance of inviting our clients in and, sharing, dialogue around, the experiences or trainings, that we've had or haven't had. But I found that, what's most important is conveying a sincere knowledge or interest in learning, in valuing the client's lived experience. And so, I think inviting our clients where appropriate, into that, and also our supervisors. They can help us, kind of sort through these. Yeah.
Yes, absolutely. I agree. And I would say on the flip side of that, even when you do feel like you share identity with a client, that can present almost as much danger because you may over-identify with them. So then you need to be very purposeful and intentional around looking at their differences and asking about their experience, their interpretations, not just assuming that because we share whatever this identity is, our experiences are going to be exactly the same. That's just almost never true.
Yes, I agree, and I'm so, glad that you raised that. I was reminded of the a tool called the cultural formation interview, and that is something that can be used, in early sessions with clients, maybe at different points, but really wanting to understand those pieces of our clients' experiences, how they think about themselves, how they think about, the problem or the goals, things that have factored into that. And I love what you said because I think that's a great practice to use with all clients. I've had sometimes come up in the classroom where students are like, "Well, I didn't see like any like cultural aspects, so I don't know that I would use that." And it's like we all have cultural aspects, and that is just so.
Yeah, absolutely. Okay, I'm going to move on to the next question, and I'm going to ask you to give an example of one of the most difficult ethical decisions you've had to make in your career, and maybe how your perception of that event changed over time, or how you would maybe approach it has changed over time.
Yes. Um, I think that some of the most challenging things that I've encountered kind of relate to some of the challenges, that we talked about with, new counselors. They're hard facets of our profession. Um, Related to my work in family counseling, an ethical dilemma that when I was preparing, for today that came to mind is when a family might have different parenting practices or gender expectations, even, values than my own, and how I, as the, counselor, can help um, support them, empower them, And also, there are things that can be beneficial, for family functioning. And so I think that dilemma of, you know, um, when does it make a difference? Does it make a difference? And I think that that is one thing when I was thinking about value differences, coming back to like, does it matter? For the work that we are there to do with the client, does it matter? And that it's okay for that answer to be different than it might be, for another person in my life, like a friend or family member. So, I was thinking about a particular family I'd worked with a number of years ago, and it was a blended family that had recently like moved into together, and there was a lot of military involvement in this family. And in the session, the I guess boyfriend, said to the child a lot of times, like, you just need to man up. You need to like man up, just do this. And that, was challenging, to me. And so there's more details, but that, is a slice of it. So really, trying to work with the family of, to kind of break down that, even break down some of the assumptions that I might have had about what, they meant by that, or, what might be some of the motives or hopes, with that. And could there also be, potential challenges or, not really getting what we want from that, which my goals with the client is to help them, to function a little bit more effectively. And, layered into this, there were also some homophobia, kind of transphobia. And in retrospect, I wish I would have talked about it, more with the supervisor. I think I did some. I think also, when working with families that might have a child that is either exploring or, aware of, maybe a gender identity or a sexual identity that is different than what the parents, maybe thought or expected. I think that's such an opportunity for me to, help bring in a lot of compassion and hold space for, the fear and unknowns that can surround. And how I see, it's not, my job that we're all going to end up on the same page regarding all of that. But as it, relates and keep going back to like our purpose as a counselor, we do know that, family support, family love, whatever that means, is really a key factor in, children's lives, in, future risk. And so, with that dilemma, trying to take it back to like, is there something that we do agree on, like that we care, about are, care about this, or we all, want this, and we can kind of rally around that. So, um, yeah, thanks for letting me share a little bit about that. I feel like I want to be like, oh yes, I did it all perfectly then, and I would now. But I would say that that is a ethical challenge that I, have encountered in my work and, in working with families, particularly. Yeah.
Yeah. Thank you.
Yeah. Anything, do you have any of your, a difficult challenge that you've come across?
Mhm. The one that always comes to mind for me is an older one, but I was under supervision, so after graduation, but working towards licensure, working at a children's advocacy center. So I saw a lot of kids that had been abused and neglected. Of course, they've already come in through the reporting procedure to the police, so I often didn't need to make additional reports. I did have a client, she was 14, and she disclosed to me in session one day that she was pregnant. And I think this falls under the risk category that we talked about earlier. When do you break confidentiality due to risk? And it was a case that I needed to talk to my supervisor about because of her age, and we know that the maternal health is very important, and a child, especially a 14-year-old who's still a child, essentially could be put at risk if her parents do not know that she is pregnant. And so after consulting with my supervisor and looking at state law and other things, we did decide that I had to disclose that to the parent. I talked to the client first about that and let her know that that was my ethical duty. I gave her options of her disclosing to her mom, who usually brought her to sessions, or me meeting with her mom separately. I gave her multiple options. So she felt like she had some control and autonomy over this, even though we still had to report the situation. And she chose to tell her mom with me in the room. So we brought her mom in, she talked to her, and her mom was supportive and said they would continue that discussion after counseling. And so that situation went well. They don't always go well when you have to break confidentiality. I've had clients not come back, especially if I had to report outside of
Yes.
the family unit. But in that instance, it did go well and the mom was supportive. But I think that the pregnancy piece is one that we don't talk about as much as around breaking confidentiality. But with minors, you really have to be mindful of sort of the imminent risk in that.
Yes. Yeah. Yeah, I agree. And I like, when you gave that example talking about, consultation with your supervisor, and then, involving, the client in that, where possible. And while, that doesn't always guarantee success or like maintenance of the therapeutic alliance, I too have found that, to be helpful. And so in instances, where I needed to make a report maybe to Child Protective Services. There's been times when I have been able to do that actually with the parents themselves. We can make that call together, and they, may too recognize like we do need some additional support, or I'm not sure, myself, kind of, what to do here. And so I think to be uh, transparent and direct with our clients, and honest, it doesn't make it all perfect, but that's what I would want, if I were though. Yeah.
Yeah, thank you. So, the next question is about bookending your own values. How do you maintain the balance of bookending your values to get into the world of the client while also maintaining your ethical and legal obligations as a counselor?
Yeah, I this is another really good question. I think that part of it, I'll relate back to what we've talked to, is really asking myself, what is my job here? Those are, some of my bookends. Does this make a difference? And so I think that first and foremost. Another thing that I guess I wanted to dispel or maybe give some more voice to is also this idea that, as counselors, like we should and can just like leave our values at the door. Like you just, walk in and they're gone. And then when you leave the session, you pick them back up, or whatnot. And that, it doesn't, at least in my experience, quite, happen like that. What is important is for us to, consistently be reflective and cognizant of, what we are experiencing, what's going on in the therapeutic, relationship, and that's like an ongoing thing. So we just, don't read in the code of ethics that we can impose our values and then they go away. I think related to that also that, when we think about values, that means a lot of things, and that um, I think in a sense it's kind of impossible to work value free, our how you show up, how you have your office, what's in your Zoom, virtual background. All of these things can convey, things about us. I also think about, where it can be helpful to bring in values, which I believe, is a question I've heard as well. And we have values of our profession. There are values that we are bringing, into our work. Things like a belief in people, hope, respect, autonomy, this idea of the whole person. And so, there is that, process, happening as well. And so I'd say that, some of those serve as my, bookends, and they're bookends that I consistently, pick up and put back, on the shelf, on the metaphorical, shelf. Yeah.
Thank you. That's so helpful. And you actually kind of did speak to the next question, which is when, if ever, have you shared values with clients? And it sounds like you, and correct me if I'm wrong, you share when they are like representative of the counseling profession.
Yes, I would say so, and that might be in like direct word, or also, just the space that I strive to uphold and like co-create with the client. I think they're reflected there. Related to this question, and I think it's also a value, is this idea of, broaching, and asking our clients to, share what is important to them, to that their um, cultural identity, their, multifaceted identity is welcomed and wanted and important, to the work that we're doing. And I'd say, particularly if these are identities maybe that have been marginalized or not as like well represented, the client understandably may not feel comfortable or, empowered to integrate them. And so as a counselor, I think it's our, going back to that onus, our responsibility to broach and acknowledge that space, and flatten out, some of the power differentials that can exist there. And so I would say that, in a way that is bringing in a value, by broaching and, really inviting our clients into that space. I think the other thing that I wanted to share is, I guess this relates to my, values, also thinking about as counselors, our code of ethics and responsibilities to evidence-based practice and using, um, you know, research-informed practice. And so that I'd say is something that, I've also brought in that I thought maybe, could be considered a value. And one, thing that I like to do with that, that can be in the form of psychoeducation. I think that, knowledge is power. A phrase that I like to use sometimes is, either like something that we know, the general ambiguous we, but, something that has been found, or maybe something that other families, have found useful is XXX. And so incorporating, that research, that knowledge, that evidence, and with, choice and flexibility as far as, how and if our clients use that. But I think, that too, is some of that infusing of values or just, kind of other things into the session. Yeah. What about for yourself? This is a really good question.
Yeah, thank you for sharing your thoughts on it. I think that my thoughts go to the beliefs and values I have around client change, which again, I think are part of our professional identity. I believe that all clients can change if they want to, and they, see the value in that. And so holding that like belief close to me when I'm working with clients, but also knowing that clients go at their own rate, and so change looks different for everyone. Like I personally and professionally have a value of creativity. I think that as like a trauma focused person, not everyone processes verbally very well, whether that's from trauma or just personal preference or ability level. And so it's important to me to bring in different ways for clients to express themselves. So I use a lot of creativity and just different methodologies in my
Mm,
sessions. We may still be doing a trauma narrative or some other evidence-based like focus activity, but I use a more creative way to get to it. And so I think when I bring my values into the counseling room, it's because there is a rationale for treatment.
yes.
Um, and those values are personal, but they're tied to my professional identity.
Absolutely, absolutely. And um, two other thoughts, if I could, on this. One is, I found in some of my research and some of my own experience as we continue to make sense and grow in our professional identity as counselors. We, may take on, and there might be some interplay between like our personal and professional values, that becomes kind of more holistically, a part of us. And, that we see some of the values of the profession, not as like outside of us, but that, they're a part of us. And then also as, counselors, we have a commitment to uphold them, also to be, advocates, to really, advance world kind. But I was just, yeah, thinking about that, with our personal and professional values. And then the other thing I think that is important to note here is related to like spirituality and religion. And for many of ourselves, our, religious or spiritual values, worldviews are really important to how we make sense of the world. And so I sometimes have worked with newer counselors, again, any counselors, of like, oh, am I allowed to do that? Like, I'm not supposed to like, I'm afraid to like put any values in here. And I'd say that, the research, some of what we know, underscores the importance of that and inviting, that into the space, with our clients. With that, I'd say, maintaining some of those like bookends of it being client led, client initiated, also, as was spoken to, even if you maybe share an identity with a client or think that you do, to realize that that really can be so diverse and to not, to be almost extra careful of assumptions. But I think that's, important to note. And, for those of us that maybe like aren't as religious or spiritual, we might have to, you know, kind of put an extra reminder of that, like, oh, to engage with our clients in that and kind of get a feel of what that means for them.
Yes, culture is layered, right? And
Yes,
so a client's culture is not just their gender or race or family upbringing. There are many aspects to it, and spirituality is one of those aspects.
absolutely.
I think a thorough intake looks at many different types of culture as well as trauma history and anything that your client is bringing into the space. And of course, clients will also not tell us things in the beginning sessions, and then 5 sessions later, we find out something vital, you know.
Yes, yes. And I have also been the client in a counseling session. And so I think it's a good segue, to talk about, to the importance of our own, personal counseling, our own work as part of being helping professionals, but kind of, I can understand well, I might tell you if you ask me, but if you don't ask me, I may not know how or when or why or really want to, talk about X, Y, or Z.
Yeah, absolutely. I know I've been, in counseling multiple times throughout my career and have always found it incredibly helpful.
Yes, yes.
So. All right. Well, we have two questions that I'm going to kind of lump together to finish out our interview today. And they're about documenting decision making. As you know, and would probably agree with, if you don't document it, it didn't happen. So that's, I think, a good motto to have. But how do you think that, particularly students and new counselors, should document ethical decision making? And then how often should they document it?
Mm, yeah, great question. And I think, there is this idea if you didn't document it, it didn't happen. And then also it makes me think of, and if you did document it, someone else might at some point see that or, to be aware of that, as well. Um, and I think documentation is definitely one of those things among many that are site and context, specific. And so, but particular to ethical decision making, I really like to utilize an ethical decision making model as part of my process and as part of my documentation. I really like there are lots of different models, but I really think that the American Counseling Association, they offer I think it's like a 7-step model for ethical decision making that I find to be, pretty applicable in a variety of settings. It helps us work through a process of, really looking at our code of ethics, looking at our state requirements. Also, um, our process of thinking through different possible courses of action and consequences of those, and so showing kind of that thought process, as well as our consultation with others. And
Yes,
so
that's one of my favorite parts. Yeah.
yes,
Is that
absolutely.
the consultation is built in, so you know to do it.
Absolutely, absolutely. There's also a model that I really like and we could share as an additional resource along with this interview, but that looks at values-based ethical conflicts specifically. And so that is a model that I found, myself using. And so with documentation, I am thinking, about the actual case note, and then, we also might have notes that are maybe not a part of the like formal file. And so like each of my steps, on that model, I may or may not include like in my case note. It might be like used, you know, the ACA ethical decision making model, and that might be what I have like in my actual case note, or that I consulted with a colleague, and so you kind of documenting those steps in our case notes, for sure. Um, But I think that this idea and question about documentation is really important, because it also, for me, reminds me the importance of actually like walking through the steps. Maybe as a new counselor, um, with an ethical dilemma for the first time, we might be like, okay, I'm going to go through every step. Then as we progress, it might be like, yeah, I kind of know this. I just do it in my head, or, I did it right. And so I do think it's important to actually, take time um, you know, to write out, to think through, to work through, those different steps of an ethical decision making model. Even if, what were to end up in my case note might just be that I did it, but to actually have that process. Because I've found that I learn a lot, through that, things I hadn't, thought about, or even if I'm fairly certain what my, course of action might be, to actually think through, what could be some of the consequences, known or unknown, for that. What might be alternate courses of action that maybe I'm not aware of, but after talking with a colleague, they're like, oh, this, could be available, or did you, so yes.
Yeah, no, I agree with that. And I think that when I see this question, I see, sort of that uncertainty of how much to share with the client, which you kind of talk about. Maybe in your case notes, you just put that you did the ethical decision making model, but you have that paperwork separately. And I think that if counselors use this best practice moving forward, we would see far less spikes in, reported incidents to boards later in life. We know that sort of ethics incidents spike at like new counselor and then around 10 years and 25 years based on data from our insurance. However, I think that many of those like 10-year to 25-year incidents are counselors who get, as you said, a little too cocky about knowing what they're doing and don't follow those steps through to double check themselves.
Yeah.
And so, how many of those incidents could we prevent if we just keep using our best practices and literally working through and writing out an ethical decision-making model?
Yeah. Yeah, I think this is good. And it also, I was thinking, even like a step back of like, what is even an ethical dilemma? Like, when do we recognize these coming up? And sometimes they are, I think, more obvious, like more, concrete. And at other times they can be like more, subtle. And so I think that, when I think about ethical decision making, that's been a important barometer for me. Also, in supervision, or when I think about, now when I'm talking with peers, it's sometimes a thing I don't want to talk about. Like I just kind of want to like sweep under the rug, or like, I remember as a student, like I want to try to like fix it myself. I don't want to like make a mistake, either in my supervisor's eyes or in my client's eyes. So I'll just try to like figure this out in my like corner over here. And I have found that, that are often things that are helpful to bring to light, either, for more ethical decision making, or just to, to be able to talk through. Because, I found the thing I didn't want to talk about with my supervisor, I didn't, but then I would have a next session with the client and it still, what was there. And so it helped, me just to feel actually more empowered and able to, look at it. But I think this is why it is so important for us as counselors to be engaging in ongoing and rigorous self-reflection, and to pay attention to some of those, cues.
Yes, that is such a good point. I think the moment that you have the voice in your mind that says, I don't want to share this, you're probably feeling some shame, and that's the exact thing that you need to share.
Exactly. exactly. Yeah, yeah. Yeah, and yeah, shame can be, so powerful. And I know that it can be present, for myself. And I was thinking about, all of the really fortunate experiences, I've been able to have with counselor and so with supervisors, with peers that I really trust, and that, the response is, I don't want to say never, but it hasn't, been like, oh, why did, it's like understanding. And so being able to, to speak honestly about that, I think is really important.
Yes, I agree. Well, I want to be mindful of your time, but also thank you again so much for visiting with me today and having this conversation. I appreciate your insights, and I know that our students will too.
Wonderful. Thank you so much. I was good to sit and talk some ethics with you today, and I hope you take care.
Thanks.